is to give somewhere to hold the arm, to take the weight of the arm, so the trapezius is more relaxed for you. Good. Now, the fiber direction, it goes down. Okay. So you remember, in order to find taut bands within the muscle, I must go in a perpendicular manner. With one hand, I'm holding the muscle, and with the other, I will go perpendicular to find taut fiber. So this, for example, is a taut fiber. Now we'll go a little bit more superficial to the muscle. Here?
A little bit.
A little bit. It's another taut fiber. I don't know if you have a good view. So if we go to the deeper parts, we discussed, like this, pain?
Little.
Okay. Now, the second step is, I found the depth of the taut band, is to go and find what is the most painful spot on the taut band. So I have the taut band, and as I'm trying perpendicular to catch the taut band, I do that a little bit more lateral, and I go step by step. Now here, so I'm going laterally now, to find the more sensitized area of pain.
It makes headache.
It is?
Yeah.
More headache. Now?
Oh.
Better. So it's the same taut band, but I'm trying to have like a diagram. It's less, it gets more, and again less. It's what you expect normally. Now I will go medially to see if it gets more or less. So I will change. I will stabilize the muscle pain.
It's okay.
It's better.
Yeah.
So it's not very sensitized as you go medially. It's not the biggest problem on here. So that means that practically, so you can see I'm going up to the muscle, and I can go up to the... So for me, it's somewhere towards the shoulder, but not very far towards the shoulder. Let's find again, somewhere here. It's worst here or here.
The first one.
If I found the main part, I do the final adjustment left or right. So I will stay in the place, and I will go a little bit to the left as much as possible. It's more this.
Can you try one more time? Oh, I think this way.
Okay. So here, if I judge that this is the most painful place, that I call it myofascial trigger point area. I call it the most sensitive area of palpation. So here, the first technique you can do is just press it. 1A, we call it.
Yeah.
However, I prefer a technique with movement. We call it 2A. So instead of staying on one place, which is very tiring also for your hand, but it's problem for here because it's constant pain, I'm going to the fiber, and I'm moving a little bit to the left and a little bit to the right. So I have an on-off technique, it's called. It's pain, no pain, pain, no pain, pain. So this has two benefits. First, it's more tolerable. That's the one. The second, it's mobilizing locally the area. Sometimes you need to find it again. More or less here.
I think more.
More or less here.
Less.
Here?
Mm.
So, the technique I will do, I will stabilize with my left, and with my right, I will go left and right 1 centimeter. That's technique 2. So, we don't like the pain to not be tolerable. Softer. So, it's painful, but must have a good toleration. Now, till when I'm working. So the first is that my hands cannot hold forever. So I can stay in the area, and after 20 seconds I can do a small break, and then I can go on. That's one. I work till there are 2 factors to decide where to stop. The first factor is to tell me that I don't feel your pressure a lot. Do you press less than before? Pain? Better. So the moment she feels that the pressure is not very painful, it's somehow desensitized, so I can stop treating. That's the one. A second criteria is that I feel a bit softer in my hands, that it's not very tension. A third thing I can do is to reassess. So, how do you feel?
Better.
Can you do the movement?
This way it still has pain.
It can be the same, can be more, can be less. What of the three?
Same.
It's same. So it's maybe either needs some treatment more, possibility one. So it's more dose. It's possibility two, it's another trigger point in the same muscle I didn't find. Third possibility, it's another muscle. So I must go on treating her. If it's a real patient, I must go on and search these three possibilities. At the moment, I don't know. Good. So, would you like to try it? Left, right, side flexion, flexion extension. See which side has either more restriction of movement or more symptoms. Do the pinch grip on the upper trapezius. First, you must go perpendicular to find a taut fiber. If you find it, you must go across the fiber and find the most painful spot on the fiber. And then stay on the trigger point and do technique 1, stable, and technique 2 with movement. Now, if the person has a lot of tension and you cannot palpate, either use something below the elbow to deload the muscle or ask the person to come in prone. It's the same in prone. It's the same process. Okay?